I'm Dr. Jennifer Levine. I am a double board certified facial plastic surgeon on the Upper East Side. And today we are going to talk about something that's really, really important to me, which is why you should choose a female plastic surgeon. I happen to be a facial plastic surgeon, and I think it's really important to trust your face to someone who only does surgery on the face. And the most important thing overall, of course, is to choose a qualified surgeon. So there's many qualified male facial plastic surgeons, there's many qualified female plastic surgeons, but we're going to talk today about why women are better. And I think that this is a great topic, and I think that it's so important now more than ever with everything that's going on in our world, in our country, in our society, that we as women really take charge of ourselves, of our faces, of our bodies, and our lives. So I want to just tell you some interesting things about female surgeons in general. So there's not that many women surgeons, even though about 50% of the people in medical school are women, most of those women don't choose careers in surgery. And that's like a topic, I guess, for a different Facebook Live. But what we do know is that 90% of plastic surgeons are men and only 10% are women, which is really interesting because 90% of the patients that are looking for plastic surgery are women. So there's a real disparity in this relationship, and I think it's really important for women to really speak to another woman about their face, because the face is a really unique part of our bodies, and I think as women we have a different perspective of how we'd like our faces to look, kind of what are the changes that we see in the mirror every single day. And we've been looking at our faces, we've been putting on makeup for a long time. So I think it's really good to get this perspective. So what we know about women physicians in general, and of course this applies to facial plastic surgery as well, is that women are better listeners. So when someone comes to see me for a consultation, the first thing I do is listen. I ask questions, and then I wait. I wait to see what that person is going to tell me. What are their concerns? What are her concerns? What would she like to change before I go in and kind of deliver my opinion? I want to know what are the things that bother that woman every single day about her face. And of course, I want to educate. I want to explain, why I might see things differently, but I always want to address the concerns of my patient, whether women or men. And this actually applies to men too, because men like to be listened to as well. So it's not only women, but men like to be listened to as well. I think that women in general are also better communicators. So we want to have a discussion. And one of the things that I really, really like about my job that I didn't know when I was in medical school is really, this is a journey. So it's not about people getting a procedure and then I never see them again. I see them again, I see them regularly, and I often see different members of their family. I could see their mom or their daughter or their husband or their cousin. So, and I get to see them over time. So I think it's a really great thing because this is really a journey. Aging is a journey. So these changes that we have to do to our faces or our bodies have to be kind of continuous and over time. And I think that's a really good thing. Of course, if someone wants to come up with a cure for aging, that would be great too, but so far we haven't come up with that. So I think it's a really great opportunity to kind of build a relationship and kind of keep this conversation going. So that's kind of my gestalt about this whole process.
So we've had some questions come prior to the live, so I just want to kind of go over those with you, Dr. Levine, and
sure.
see if you can answer them for us.
Sure.
So I think what a lot of people want to know is how do you see things differently than a man? Obviously, we know that women tend to listen better, communicate better, but how is your view different when you look at a patient?
Okay, so for those of you who don't know me, I kind of have two sides to me. So I have a very artistic side, a very creative side, and I also have a very mathematical, scientific, and analytical side. So I read this study And the study said that men actually preferred more stylized images than women do. So women overall, when these women were tested, we prefer more natural images. So I think that we as women, we gravitate to a little more natural result, while men overall kind of go more to a more stylized, I don't want to say cartoonish, but certainly more dramatic, like, the bigger cheek or the fuller lip or, larger breasts. And we as women, that's not always what we're looking for. So we're not looking for some ideal image. We're looking at what would be best for us. So most women have very realistic ideas of how they could look or how they want to be. Some people want more dramatic changes, but that doesn't mean that they still shouldn't appear natural, which I think is one main distinction. For me in general, I kind of feel, because I've kind of been artistic my whole life. I took a lot of drawing and portraits and a lot of other art classes, that I have a better artistic view of the face. And in order to create the most beautiful image, you first have to see it in your head. So because I can visualize that, best, most beautiful result, I feel like I'm able to then deliver that to my patients.
How do you feel that your results overall are different?
I think that my results overall are more cohesive, and they blend with the whole face better overall. So instead of just saying, okay, we've done Botox and now there are no wrinkles in the forehead, we want a face that is rejuvenated in all parts of the face. Or even for younger people, we always want a face that's balanced. So we want that kind of balanced, nuanced look. So there is, a certain beauty that is made by making bigger results, but it's also the small details that really elevate that result from being just okay to really being beautiful.
Do you feel that the disparity in the percentage of men versus female plastic surgeons motivated you to become a plastic surgeon? Or I guess, what was your motivating factor?
I think that, I was born in the 70s, and that was that like Angeli commercial that you could do, where you could do everything. So when I was going to school, or when I was learning, I didn't realize that I couldn't do certain things because I was a woman. It never occurred to me. So I kind of always did what I had to do, and it didn't occur to me until later, when I got more out into the real world, that other women weren't doing the same thing. So I was kind of in for a rude awakening about that. But I think it's really important that there shouldn't be fields that are men or fields that are women, but everything should be for everyone. And that's really what I want women to feel, that there should be no barriers, that everything should be the same. And why shouldn't women have the same opportunities as men?
So what approach do you take when evaluating a male patient?
So I think that, again, we are going to go back to the same thing, where I'm going to listen a little bit to what the person has in mind. And for men in general, I think they really appreciate someone listening to them. Sometimes the men are also just a little more like fact oriented. They want to know exactly what's going to happen and in which way, and how much downtime they're going to have, and then they're kind of like ready to go. I think that sometimes women, believe it or not, tend to ask more questions. They might be a little more thoughtful. They might also be a little more price conscious, especially if they have a family or other people that they have to take care of. It may be harder for them to justify doing something that's for themselves. So I think all of these things are really important to take into account.